You're watching Local 24 News at 10.
Well, welcome back to the special edition of Local 24 News at 10, and we're going to pick back up with a question from Tracy Trotter. She wants to know how many people actually have coronavirus and how many people have actually survived. Our Annette Pegler getting you some answers. Annette, what did you find out?
Well, Katina, according to the World Health Organization, there are currently more than 152,000 people with coronavirus worldwide in 144 countries. More than 3,000 of those cases are right here in the U.S. Those statistics were updated this morning. Now, the World Health Organization estimates roughly 5,700 deaths worldwide, 41 in the United States. As far as the survival rate, according to Johns Hopkins University, deaths are more common among the elderly population. And when it comes to those 80 years old or higher, 90% will recover. Now, that mortality rate is around 1% of those who contracted the virus. Katina?
All right, thank you so much, Annette. And we are back with Dr. Connor now. Thank you for sticking around.
Absolutely.
People have many more questions. And look, not only are you an MD, you're also a pastor.
I am.
So some people are saying, I don't know what to do. What can people do to actually calm themselves down during this time?
Yeah, I think that it's a blessing that we live here in the United States. A lot of those cases that were found in China, over 3% or so of those cases were in a country with poor access to health care, and I believe they don't have the robust health care system that we have here in the United States. And so there have been less than a 1% even on those cruise ships that were out there. So I would say that to calm down, we really should just continue what we're doing. Like you said, the hand washing, making sure we educate ourselves. I think education is the best knowledge that we can do. I would trust local sources like yourself, make sure that we're reading the news from the CDC, and not believe everything we see on social media and some of those outlets. I think we should really get it from a trusted source, from our local health departments, or even from, like I said, the CDC.
Okay, another thing that we want to sort of calm people's fears with, stores can't seem to keep their shelves stocked. We're talking about paper towels, we're talking about tissue, we're talking about hand sanitizer, we're talking about food, and that's causing a bit of anxiety too. Should people be trying to rush out and get these things, or can they take a minute to breathe and just wait to see what's going on?
Yes, I think we can take a minute to breathe and see what's going on. Again, it's being spread at this point from surfaces, so making sure we were wiping down surfaces. We're just doing those precautionary measures to make sure that we keep ourselves and those that are around us safe. If you have a fever, if you have those symptoms, maybe self-quarantine yourself for 48 hours to whatever that time frame may be, 2 weeks. This is flu season, so we have to be certain that we kind of, sort out, is this flu or is this corona? But the average person who may get corona, unless they have comorbidities, they're already, they won't really have those bad symptoms. They may have a scratchy throat, maybe a cough, maybe some muscle aches, but that's about it. They should present mainly like the flu. It's those that we really worry about who have immunocompromised states, or if they have...
Meaning what?
Meaning those that may be on chronic steroids, diabetes, sarcoidosis, those that may have asthma, anything that affects the lungs and the heart, those that we have to think that they're at greater risk.
Okay, we have about 10 seconds left. Tell people at home what else they need to know about coronavirus that's especially important for them now.
I think at this point we should just maintain where we are, continue to educate ourselves, hand washing, and making sure that we keep the social distancing, making sure that we keep those things going. I think we'll be fine.
All right. Elbow bump, thank you for coming in.
Absolutely, thank you.